This is a review on veterinary toxicology, focusing on cardiac glycosides. Also, a quick disclaimer, this is for educational purposes only and does not replace any advice that you would get from your licensed veterinarian. If your pet is experiencing a medical emergency, please seek the advice of a veterinarian. So cardiac glycosides are a type of toxin that affects the heart, and they're found in many different plants and medications. The mechanism of action is that they inhibit the sodium-potassium ATPase pump in the cardiac muscle, which leads to a buildup of sodium in the cell, and then that leads to a buildup of calcium in the cell. And as more calcium builds up in the cell, you get even more calcium that's released from the sarcoplasmic reticulum, which is the storage in the cells to store calcium. And then the more calcium that you have, it binds to troponin C, and then that increases the contractility of the heart, also known as inotropy. There's also an increased vagal activity on the heart that then reduces the sinoatrial node firing rate, and then that leads to a lower heart rate, which is known as negative chronotropy. So overall, you're getting more forceful contractions, but fewer contractions. So cardiac glycosides are used in veterinary medicine to help our patients with heart failure, and then those that have certain arrhythmias like atrial fibrillation and atrial flutter. We use digoxin, which was found from the foxglove. But we have to be very careful in giving these medicines because, as we know, they are toxic and they have a very long half-life in the body, and they accumulate in high concentrations in the plasma, and it takes a really long time for these to clear. So you have to be very careful and give the appropriate dose and be sure not to overdose animals when trying to treat them. An example of plants that contain cardiac glycosides are oleander. We also have the foxglove that we mentioned before, lily of the valley, kalanchoe, the broadleaf milkweed, which accumulates in caterpillars and is found in the southern Great Plains and southwestern US. Signs of toxicity that you would find are extracardiac and cardiac specific. So the extracardiac ones you'd see are vomiting, anorexia, weight loss, depression, diarrhea. Electrolyte abnormalities are hyperkalemia and hyponatremia. And for cardiac signs, you're basically going to see an arrhythmia, and it can be any type of arrhythmia. Treatment for these patients induce emesis only if they are asymptomatic, or else it can be very dangerous. Activated charcoal is an option. It decreases the digoxin absorption. IV fluids, you have to be very careful, and you can't give them any calcium-containing fluids, and that includes LRS. So you have to give something like sodium chloride. And then you want to be monitoring these patients using an ECG. You want to monitor their serum electrolytes, their blood gases, and their potassium levels. You want to give specific antiarrhythmic drugs, including lidocaine, propranolol, or atropine. There's also a very specific antidote called Digibind, and it's a dioxinamine fab, and it binds to the drug and inactivates it, but it can be very pricey, so it's not as likely to be available or used by clients because they might not have the funds to pay for it. Another thing that contains cardiac glycosides that's not a plant is the Bufo toad. The toxicity depends on how much of the secretions are ingested by the patient and then the size of the patient. Treatment, you want to rinse the mouth out, point the hose away from the throat so that they're not swallowing the water-containing secretions from the toad. If the whole toad is eaten, you're going to have to induce emesis if it's safe, or remove it with endoscopy or surgery.